We've created this video as an introduction to a commonly used technique for ultrasound-guided cannula insertion. It's not a substitute for hands-on practice. Please make sure you're confident in performing it before attempting it on a patient. Remember, ultrasound-guided cannulae should only be used as a last resort when multiple attempts and people have failed using the conventional technique. Always ask for help from a senior first if you're struggling to cannulate someone. Ultrasound-guided cannulae tend to be deeper and can be more painful for patients. It can be difficult to tell when the cannula tissues, so they should be monitored closely. And finally, if the patient is truly difficult to cannulate and is likely to need ongoing IV access, please consider whether a PICC or central line might be required.
So the first thing to do is, once your machine's on, is to make sure you've got the correct probe. So you're choosing the high frequency linear probe. You don't want to be choosing the curvilinear probe, which is for deeper structures, for example, abdominal ultrasounds. And also on the machine, to be able to adjust it, so there's two main things you need to change. One is the depth, so at the moment it's at 1.8 centimetres, and you can just twizzle the knob to change the depth. And then there's the gain, which is equivalent to, say, changing the brightness, so brighter and darker, okay? You also need to orientate yourself with your probe, so you know which side of the screen is equivalent to which side of your probe, and that's by the dot and the dot, so they're both the same side. So if you tap, see, this side of the probe is equivalent to that side of the screen, and that's the way round you want it to be. So apply a tourniquet as normal to the arm, prep the skin with some ChloraPrep, and make sure you have plenty of jelly to get a good image on the screen, using the sterile lubricant. Then you need to make sure your orientation of your probe is correct, as we've explained earlier. And now I always start in the antecubital fossa. Okay, so you identify that large round structure there, and that's the median cubital vein. Okay, and then you can scan down from there, because it's generally uncomfortable for patients to have a cannula actually in the antecubital fossa. Obviously all the difficult patients might not be this easy, but you follow, then scan the vein down, and you can see it divides there into two smaller veins. It's lovely and straight. So you pick a straight area on the forearm, so around here. You can see that the vein is compressible, okay, so it's not in the artery, and then you can cannulate. Okay, so keeping the vein in the middle of the screen, and also so you know it's directly under the arrow on your probe. And having your cannula ready, warning the patient there's going to be a sharp scratch, so starting at a distance not right up against the probe, but about 1 centimetre away, because you can see on the screen it's, you know, maybe 5 millimetre depth. So starting a little way back. Okay, so sharp scratch now. Okay, and then as you can see, the needle is coming onto the screen, and you can see it puncturing the vein. Okay. And now the key is that this is a cross section, so you follow up with the needle, and you keep following it up all the way until you're happy that it's well positioned in the vein. So you can see it right in the centre there, so I know that I'm not pushing against the edge. I'm nearly up to the hilt now, which I didn't really need to do. Okay, and then you can just slide the cannula off and withdraw the needle. Okay, so make sure you remove the tourniquet unless you're taking blood. Remove the needle and then place a cap and flush as